All right. One thing I really want people to understand throughout this conversation is that this issue is bigger than just one breed, right? It's about modern culture influenced decision making, how emotional attachment can sometimes outpace preparation, and how veterinary medicine now has to navigate conversations that are becoming more difficult, more emotional, and more urgent. Because many owners truly love these dogs deeply, but love alone does not replace education, preparation, or proactive medical care. And as veterinarians, we also have to ask ourselves difficult questions. Are we communicating clearly enough? Have certain levels of dysfunction become so common that even parts of the profession have unintentionally normalized them? And what should responsible ownership and responsible veterinary guidance actually look like moving forward? Those are the conversations we're having today. All right, Doc, let's get back into it. We talked about the financial burden that comes with these costs that most pet parents have no idea. How about the emotional tax? What does that broad spectrum conversation look like for these pet parents?
This is a highly um, emotional issue because we see a pet suffer, right?
Yeah.
We have friends with dogs and going to the dog parks and having a great time outside, and we worry about we have constant fears. The pet parents have constant fears of seeing their pet not being able to breathe. They think in their mind, if that pet can't breathe while he's at home, how on earth is he going to be able to breathe going to the vet or to have the surgery? How is he going to make it?
Right.
So this is a real big guilt problem that we have when we see this on our end. And it's normal for us to feel that way. You know, we have to process, yeah, this is really frustrating. And, you know, there are solutions to problems, but we have to really understand what those solutions are. And our job as veterinarians is to present them in a simple, easy to understand. Talk to me like I'm a fourth grader, right? Explain to me what my problem is, what my dog's problem is, and how you're going to help with that problem.
Right.
Explain to me what the possible risks are. Explain to me what happens if I don't do anything. I think that these opportunities are there for us to take advantage of because that's our job is to help pets not suffer.
Right.
So if we can't communicate in simple terms, any problem, it's going to be a problem for that pet. And we want to solve problems and not have those problems linger.
I love that. And we want the pet parent to be receptive to these conversations because it's tragic when we're here with all this information and knowledge and you're like, nope, windows down, doors closed, don't care, he's fine. And that hurts us, you know what I mean? Because we can't unsee that. And we know sometimes that disconnect for whatever reason it's not the pet's fault. So we do need people of interest in this breed to really come with an open mind and a financial pocketbook ready to take on such a burden because it can get costly with this type of breed or brachycephalic in general, depending on A, B, or B, C, or D, right? So we'll run that system and just keep an open mind, family. It's important. Who tends to be the most infected when influence drives ownership faster than education?
So, the most affected are people that just haven't done their research, right? People that respond to the instant cuteness, but haven't done their homework before, making that, choice to bring that pet home.
Yeah.
And these are families that, may have had good intentions and may have children at home that wanted, the pet because they saw it at the puppy store.
Right.
These are not bad people, but at the end of the day, the more education there's out there, right, which is free, which is on YouTube, which is why we put things on YouTube, which is why we put things on Instagram and TikTok and Facebook and all those places for people to find them. The more we educate, the better, this awareness issue will become. So we have that onus to make sure, if we're not going to be doing it, they're not going to understand the problem. And so keep it simple and offer, some tips.
Yeah, I mean the pet's life really depends on it. It's so important to do your research, and I think as a child we had this instant understanding of when I grow up I'm going to get that dog, and you don't do the research, you don't understand the finances behind it. how many pet parents have you had say, "This isn't my dog. This is my daughter's dog." Well, how old is your daughter? She's 4. Like,
Right.
I mean, how do you navigate through that conversation? Because the pet parent, in my experience, is like, no, that's her dog. I didn't. Does she have a job? Is she working to help finance this case? Because she's not gonna know what to do. How do you navigate through that without making the pet parent feel like you're judging?
So at the I would say when someone says this is my child's pet, our job is to help that pet, right? It's not to focus about who that pet belongs to, right? Who the actual, we say owners, but we say pet parents now more often because at the end of the day, we're all pet parents. The family members are pet parents. We see a problem, we have to recognize a problem. A problem exists, it doesn't go away on its own. Doesn't matter, if that child is 4 years old or 10 years old. If something happens to that pet, that might be an emotional pet for that child. That might be a bond that's there that will forever, long term, affect that child if something happens to that pet. It's our job to recognize when there's a problem with a pet that we turn the conversation back to the pet. It's not about who owns the pet or whose daughter it is or the cousin. The pet at the end of the day is a living being. And as human beings, our job is to take care of those to the best of our capabilities. We have to offer solutions. If they don't have pet insurance, we have payment plans, right? So we have to offer solutions that can make it feasible. Someone in the family may be able to help more than another person. So we have to make it accessible as much as possible to that pet that suffers.
Excellent. And I believe, a big discrepancy that we're seeing is just the lack of knowledge, understanding what our parents did for the family pet is different what pets truly need, and we didn't know any better, right? But if we go from what they did back in the day, which has cultivated to something more progressive, usually I say pet parents learn on the third pet. The family pet, the pet you got thinking that what your parents did was acceptable. And then on the third one, it was like, oh, that was a horrible experience. Pet number 2 was a horrible experience. I'll get the pet insurance. I'm going to follow up. I'm going to manage expectations. And I got a savings account for this animal. That's 3 generations. That's 3 decades, right? Of time that we just don't have, especially for this breed, because it's coming down the pipeline again at 17 times the rate of issues and 12 times the rate of having these issues. And we just don't have the time to manage our expectations. Tomorrow. That was yesterday's conversation. So I love how you're presenting it to pet parents. But do you think both vets and pet parents, do you believe that they are accommodating? I want to say it politely. Do you believe they're accommodating the experience or the expectation that they're having at a rate that because you see them solely for BOAS treatments, right?
Correct.
What's your percentage of success when it comes to hey, we talked about it, they understood, and they did something about it versus they did nothing about it? And for each lane, is it financial reasons why they didn't have it or do it, or is it other? Or do they go somewhere else? What is your percentage? They go left or right or nowhere at all?
Sometimes when they come to us, they've had different conversations with their vets about it, right?
Okay. So they come prepped.
Different backgrounds. Every vet may have handled it a little bit different. Well, maybe you should just get a consultation. Maybe it wasn't something that was an urgent referral, so you don't know how it was discussed before coming to you. So sometimes they'll come to you, then you present the problem in a clear and simple way. They'll understand the problem, but that's the first time someone actually laid it down, right? Someone actually told them, hey, this is an animal welfare issue. Your dog can't breathe. Your dog is suffering, right? Sometimes it's a shock to them to just absorb the information and they need to process that information.
Right.
And that's okay if it's not your initial visit. You've done your job to educate them and give them some time to process that problem. Yeah. I would say that as far as the number of pet parents that come in that actually move forward with that, it's dependent. It's dependent, like you said, on their financial expectations. We try to prep them before they come into us, right? We'll start text message conversations with them just to get some symptoms, get some basic information, common questions, costs, as much as we can to prep them for that day. Because when they come in, we do those tests on that first consultation if they're approving them,
Yeah.
right? Because we want to get that pet better sooner than later.
Baseline.
We don't want to wait for that problem to get worse before we correct it. So the more we can do before the vet visit, the more we can, form some kind of understanding of what is happening with that pet. The more we can prep them, the better it is, right? So that comes to if the dog is fearful and anxious in the car and he needs some medications to calm down. So he's not coming into you in heat stroke, right?
Right.
I've had some dogs come in with collapse, that had big problems, even in a 10, 15-minute ride. They weren't candidates. At the end of the day, you want to make sure that dog's a good candidate. You want to make sure it's handled the best way possible. So they're in the car. They have the AC cold on. On the lowest it goes, they have, maybe a towel around them that's a little bit wet if the dog is panting too much. If their dog is anxious, they can give those dogs some medications to calm that dog before the car ride. There's a lot we can do to recognize when a dog is anxious. And if your dog has anxiety at the vet, it's important to recognize that before you put them in the car and repeat that process again. So you got to handle it in the best way possible. Keep them calm before the vet visit, during the vet visit, and after the vet visit.
Excellent. Excellent advice. And what is something that you noticed when it comes to like a crisis management versus, hey, preemptive care? Like what are your 2-to-1 rates or 3-to-1 ratios when it comes to, hey, handling a crisis, didn't want to go here, we told you so, but now we're here now.
Mm-hmm.
And now it's like quality of life, or let's proceed with the surgery,
Mm-hmm.
versus, hey, you did what I told you to do, we got here, you understood it, we had the finances and ready to go. Like, what does that ratio happen?
So if a dog comes to us with an airway obstruction, if it's in collapse, I mean, that's always priority over everything else,
Correct.
right? So the first step we have is to stabilize that dog. Most of the dogs that we see come in, they're young enough and healthy enough to have what needs to be done with the proper medicines. We make a little bit joke that they're acepromazine deficient. Acepromazine is a medication that basically takes the edge off of them. Okay, so a lot of these dogs are, coming in panting, having a hard time breathing, getting too hot. In the seconds are in the lobby, in the room. It's going from 100 to 102, 104, 106.
Cooking.
Yes,
Man.
exactly. Pressure's
Mhm.
on. So get them that temperature. Recognize if they're getting too hot. Don't wait to give them the medicine to cool them down. Do the proper management. Alcohol in the foot pads. Soak them down. Get them to a point that they're stable. Give them some good drugs.
Yeah.
So that's always a priority over everything else. Now, that pet that's in a crisis is not necessarily that pet you want to go into the anesthesia that day. You want to
Correct.
get them to the point where they're back to more normal, not when they're in that state of crisis. So we get them on medications a week before we see them, to help with certain things. They often have stomach issues, so we start them on some medications a week before we see them for this procedure. We've done the pre-op test, so we know that they're good candidates, and we want to make sure they're good candidates. And I stress to any vet who wants to take this on, please do, but at least start with the cases are going to be successful. Don't take that 13-year-old Frenchie in that can barely get, up and down.
Right.
Start with the young and healthy dogs because you're going to have success with those, and your confidence is going to build with those successful events.
Love that. And then I know you mentioned not good candidates for said procedures, and I know it varies, Doc, because we got multiple issues along the totem pole. But what are your like non-negotiables? Like, hey, if you got this, or this, like I just unfortunately, what do those parameters look like?
So every problem comes with its own potential risk factors, right? So we do some pre-op tests, we do some x-rays, and it shows your dog's got an enlarged heart and needs to have the heart test done. Needs to know what's the risk level for anesthesia. Does that dog have a heart muscle condition, a cardiomyopathy? Does it have something else it was born with? They can have lots of potential issues that they were born with and nobody knew about, right? So you got to make sure that you're understanding what the risk factors are and get guidance about what to do, how to manage that patient differently to other patients. So there's not too many non-negotiables. If the pet is suffering, right, and we do our best to help that pet with his suffering, we have to set the expectations to that pet parent. If that pet's has some kind of condition that can be a higher risk factor, they have to know that hospitalization after anesthesia is most likely necessary. 24-hour care, critical care is most likely going to be necessary just to make sure that pet recovers safely. And communication is important. And also, as a general practitioner, we work hand in hand with ER. I know you have experience in ER. You want to have a good relationship with the doctors that you're referring to so that you can keep in the loop, help the ER understand what's happened, help the pet parents know that you're on board to try to help make sure that that recovery is going to be successful.
Yeah. And I think that's a great point. Communication, even from professional to professional, because I know how he operates. I know his protocols. I know what he likes. I know how he's already communicated what he's communicated with the client so that we're all saying the same thing. Because nothing like you having contradicting information and now the pet parents in the middle, like, I don't know what to do. And then the pet's back there suffering. So it's okay to talk to your local vets and, I would say assistant staff, right? You just need them. We all need each other. So, all right, Doc, let's get to the money here. Pet parent, I want a Frenchie, Doc. Or any brachycephalic, smushy face breed. Because I know we didn't give the pug life any love today, but they're not number one today.
Mhm.
However, equally important. Give me the need to understand list for the pet parent that says, hey, Doc, I'm thinking about top 5 smushy face breeds.
Right. So as far as like health risk factors, we're talking about, every dog potentially can be affected by things. Like we're in South Florida, we see dogs with a lot of allergies, which I'm sure you probably have in Las Vegas too with the heat here. So these dogs tend to have, other than breathing issues, stomach issues, allergies, which can be associated with chronic visits to the vet, right? Chronic medications, ear infections, skin infections. Their spines, their segments in their spines, the spine's supposed to be nice and flexible. Their spines are not really formed normally, right?
Mhm.
These dogs are high at risk to have intervertebral disc disease. We used to worry about the dachshunds being the number one. Now it's Frenchie's number
Oh, my
one.
goodness.
Yes, so they
Getting
got
them
to
on
have
everything.
ability to breathe before something happens to their back, right? And when they have something happen to their back, hopefully the medications can manage it, but it's likely they may need an MRI and spine surgery.
Right.
So you want to make sure they can breathe. Those are some of the things that they can be affected by. There's others, but those are probably the most common. But with any pet, I would say at this point, it makes sense to have a plan in place. Like you mentioned,
Yeah.
maybe someone has a savings account. There's a insurance trial that many of these insurance can offer to the breeders, like a 30-day trial, to at least get the pet parent aware that yes, and a trial's been started. You can choose your plan at what level you want it to be at, but at least have something in place
Yeah.
so that you have a backup, right?
Yeah.
And then payment plans, of course. Payment plans have gotten better than they used to be.
Yeah. I love that. It's important. It's so important. We just keep tying it right back in because we don't talk about it, who will? What do you think pet parents should expect from their veterinarian in terms of transparency? I know we talked about client communication, but again, how I communicate versus how you communicate isn't always the same. So, for the pet parent out there, what expectations should they have with their veterinarian? Because if they're not doing it, it's nothing against them. It's just, hey, as a professional, you got to step it up, right? And that's okay. That's when I say, hey, you may want to get that second opinion so that you clearly have that conversation and can form a communication that is reciprocated to you so that we can get compliance on all fronts. What does that look like?
So I always, when I walk into the exam room and I meet with a pet parent, I want to know what the goal is. What's your goal for your visit?
Right.
Ask a question that's open ended. Allow the pet parent to communicate. This is what's really been bothering me. My dog's been itching, or, I want to know about my dog's teeth, or, I need some vaccines done today. Make sure you address the goals of the questions and make sure if you're going to your veterinarian, you're asking some questions that you're not getting answers to, maybe just rephrase, clarify what you're looking to solve, and try to have a conversation that your vet understands and that the vet team members understand so that you can together resolve what the problem is. Because at the end of the day, we're here to resolve problems. We're here to help make sure that pet has its best life possible.
I love that. I love that. And I think, the joint message is everyone just stay curious, right? It's okay. We have our preference, we have our expectations, we have our understanding of what things we're looking for, but that doesn't mean the pet parent's going to meet us halfway on those. So entertain what you have to say, entertain what I have to say, and then we can all meet somewhere in the middle so that we can achieve said goals. Now, as the vet side, and it's okay to be very raw with our people. What do we need to do better as a veterinary community to tackle this huge animal welfare problem yesterday?
As
And
soon yeah,
be very blatant
sure,
because we need to hear this. And you know
sure.
how stubborn we are.
Yeah.
They got to hear it.
As soon as veterinarians, uh, we have this responsibility that's very serious, right? To make sure that if a pet walks into our hospital and has a problem, that we recognize that problem and that we are able to discuss, hey, your dog has a problem that's affecting its quality of life today. This is not a problem that, we wait for correction. This is not a problem that is going to get better on its own. This is not a problem that will, go away. These are problems that will continue to present more difficulties. And we're going to get to a point where we're not going to be able to correct the problem.
Right.
If they go through that stage where that palate in their throat and their nose is so closed for long enough, that larynx that has to open and close behind that flap is going to start to become weak. It's going to start to flutter and then it's going to start to remain shut. So it's going to go from laryngeal collapse stage 1 to 2 to 3. And that dog's going to end up needing to have its whole upper airway bypassed by putting a little tube into its trachea. And it's going to have to live with a hole in its throat. And that dog's not going to be able to go swimming because that water is going to go right in there. That dog is going to have high complications and risk factors for having a hole in its throat, right? So you don't want to get to the point where your dog needs that. And that's not going to be something that many people want to elect. So these are serious issues. They worsen with time. Chronic inflammation, chronic swelling leads to problems. They develop little polyps in their throat. They can develop little tumors in their airways, all from chronic inflammation and chronic pressure that just creates all kinds of problems in those airways.
Yeah. And again, that is just this listening to you talk about it is stressing me. Right. I think must have grabbed my throat at least 10 times during our communication because I can only imagine what these guys deal with. Prevention is key on this one, guys, period. Dr. Mann, I appreciate you coming out, sharing this knowledge and expertise with us. People need to hear about it. And that's what I got for you. Doc, any closing remarks? Excellent.
I would say that we have come a long way and that we should always, as pet parents, look for the best solutions to a problem. And we are able to provide solutions now that are easier for the pets to recover from. And we should take advantage of the technology that improves with time. So I would say one of the things to look for is if your veterinarian has a laser, doesn't have experience with the laser, or is looking to improve their ability to handle these cases. Vet Scalpel is a company here in America that manufactures this equipment and that provides pet parents with a list of veterinarians that already practice with that laser. And that is a resource where you can locate a veterinarian who uses a laser, or you can be referred to one down the street that may have a laser. So I would say that it's important to make sure that things are handled in the best way. They have someone that you trust at the end of the day, and to build a relationship with your vet so that you can ask those questions. Hey, what happens if my dog has surgery here? What's going to happen? Who's going to do it? What if there's an issue? Where do I need to go for ER? What do I need to be worried about before, during, and after the procedure? And you want clear answers to those questions. You want statistics and you want knowledge. So if you're not getting that knowledge, then make sure you find, a vet that can provide you with the answers you're looking for.
Excellent. Very well said. Couldn't have said it better myself. Doc, I appreciate you coming again. And pet parents, let me know what you think. Of course, once the GOAT, he's the GOAT of the BOAS.
What's funny is one person on TikTok said I was the nose and throat goat, and I thought that was kind of clever. But I did not invent this procedure. I'm just trying to help other vets learn how to do this better, and it's going to go a long way. We have vets that come not only from the United States. There is a conference that I came to that hopefully you're going to be at, where veterinarians are coming specifically to learn to be trained on the laser. Every year, the Veterinary Laser Surgery Symposium helps to educate, and there's tons and tons of webinars on this. All educational stuff, not just on doing the BOAS, but doing lumpectomies and spays and neuters and dermal procedures. Very big in veterinary dermatology now. So there's a lot of resources for veterinarians, and I'm speaking to veterinarians as well because to me, it's my passion. It's reinvigorated our practice, and it's one of those things that provides a way to get out of that doing the same thing over and over and expecting different results.
Yeah.
That's the definition of insanity. And when we're in general practice or in ER or whatever, if we don't ever look outside the box and look for solutions to a problem we maybe never offered before, then we're going to go through that fatigue. And I think that's a really important part of being a veterinarian. We're all always looking of ways to improve things. And so for that, I would say, I would urge veterinarians to look into, education.
Absolutely. All right. I think one of the biggest takeaways from today's conversation is understanding that influence itself is not the enemy. Influence is powerful, culture is powerful, visibility is powerful. But when popularity grows faster than education, eventually consequences follow. And now we're in a position where veterinarians, breeders, influencers, and pet parents all have a responsibility to raise the standard. Not through fear, not through blame, but through honesty, transparency, and better decision making. Because these breeds can absolutely be loved, but they also need to be understood. So before following a trend, make sure you understand the responsibility attached to it. I appreciate you all for tuning in. Please make sure you like, comment, and subscribe, and share this conversation with someone who needs to hear it. And as always, protect the pets, protect the people, and continue building prosperity through knowledge, preparation, and purpose.